To get a better understanding on the safety steps Boston is taking, we're now joined on the phone by Boston Mayor Marty Walsh.
Mayor, good morning, and thanks so much for being with us. First off, since we last heard from you yesterday, the governor has declared a state of emergency in Massachusetts. How is this impacting the day-to-day lives of people in Boston now?
Well, I think that we need to continue to take aggressive action now to mitigate the spread of the virus. I want people to understand these actions potentially will be disruptive, but they're necessary to keep the people of Boston healthy and safe. There's now evidence of community spread of the virus in Western Mass. There's still no evidence of community transmission in Boston. The Boston cases total 19. Yesterday there were 10 new cases in Boston as of 8:30 last night, so we're waiting to hear more from the Department of Public Health. But, we're working on internal policies for the city of Boston. How do we keep the city open, meaning City Hall? We're going to continue to work and looking at how residents interact with the city government and what aspects can be done remotely potentially. We're having serious conversations about our schools, finalizing our emergency plans for students and making sure that we know how thousands of students who receive free meals every day will continue to have access to food. We're working with our businesses and analyzing the economic impact to our hotels and businesses in our city. And I think the biggest thing I can say to people is, I know you keep hearing this, but to try and prevent the spread is wash your hands as much as possible, avoid direct contact with people, especially if they're sick. Stay at home if you're not feeling well. Continue to clean surfaces on a regular basis, both in your home and in the public, and always call 311 to be connected to the Boston Public Health line if you have any questions.
Mr. Mayor, can we ask you how you're going about making the individual decisions on what events will be canceled or postponed? We take example, the St. Patrick's Day Parade canceled, but right now you're still waiting to determine what happens with the Boston Marathon. And then, of course, Boston Public Schools. How are you deciding what stays open and what has to be canceled or closed?
We're in constant contact with health officials and talking about monitoring the numbers as we see this move forward here. I think that's a big impact, having conversations with other local electeds as well. I think the biggest thing is try and mitigate the spread of the virus and keep as many people away from potentially connection to getting the coronavirus. I think that's ultimately what the decisions are going to be made here. I know we spend a lot of time focused on marathons, but we also are working with businesses and looking at some of these gatherings we're having and what the proper protocol should be. We're going to continue to look at that and to have conversations about that. I think yesterday, for my own personal schedule, over the course of next week, about 22 different events have been canceled, and I think that we have to have serious conversations around large scale events. I'm not talking marathons, but large gatherings of people right now for the foreseeable future.